Yeah, I think, there's a lot of advances in treatments, and I think there should be some awareness for patients, for anybody who's taking care of patients with multiple myeloma that there are new therapies. And I think beyond that, then the second step would be then, how are we going to manage patients on those therapies? Because it's a little bit of, different therapies than what we had in the past, right?
Yeah, definitely. And these therapies aren't as toxic as what they were before. So definitely trying to keep them on therapy. Supportive care is important. And also looking at the patient in front of you and trying to decide what's best for them.
And, I think the challenge also is that, a lot of those patients are in the community, and a lot of those newer therapies are not quite yet in the community. And, how do we kind of, figure out this interplay between the community and the academic centers? But I think going to Bess's point is that, it doesn't matter how good the treatment you have. If you're not able to support the patients on treatments, then it's really not going to be a successful strategy. So, it's easy to say, oh, well, I'm going to put the patient on, say, elranatamab or so forth, but I can't manage the side effects, then it doesn't matter, right? And that's where it takes a team and, really, having nurses who are knowledgeable, ATPs who are knowledgeable, and, patients who, understand what to look for, and their caregiver who know what to look for too.
Absolutely. Yeah, no, I think supportive care, especially in the nursing field, nurse practitioner, that's our job, is to manage side effects. Because like you said, there's no point in getting a treatment that a patient can't tolerate. Supportive care, depending what medications they're on, the monoclonal antibodies, the bites, you've got to watch for infections. So antivirals are good. On the other side of it, if they need growth factors, you want to support them depending where they're at in their disease too. If they have myelosuppression from the disease, you're going to treat through that, support them with transfusions if needed. Other medications, you want to prevent any kind of thrombotic event. So you always have to put that in the back of your mind. Prophylactic antibodies if they need it. Also, we don't want to forget about our bone health too, and that's the bisphosphonates too. They need those depending on the case and where they're at in the disease process, but that's often a drug that gets forgotten as well.
Yeah, I think it's important for, not just APPs to know about this. I think a lot of times in the community, physicians are, dealing with patients who have many different types of malignancies. Myeloma happens to be a minority of their practice, so they also have to be knowledgeable about this. I would say, managing, the side effects, it is really, ultimately this, because I tell this to fellow in the clinic. It's easy to say, okay, newly diagnosed, I'm going to use data RVD, but then once the first complication arises, what do you do? How do you manage? Do you stop treatment? Do you push through? Do you dose reduce? But which drug do you dose reduce, right? And so being able to kind of link the drugs and their side effects, being able to assess, how patients are doing on particular treatments. And sometimes, especially for the older patients, it's particularly important. There will be signs that are not going to be, spoken, but more seen. Things like, well, the patient's losing weight, you're not sure why.